Back at Serenity now, on to day 8 of our 10 days of the Your Needs to Know About Addiction, drawing attention to National Addiction Awareness Week, which runs November 26th to December 2nd. We've found ourselves on to day 8. If you want to understand the level of addiction, you need to understand the level of pain or trauma experienced by the individual. According to Dr. Mate, in order for humans to thrive, they need an environment of compassion and nurturance. If you look at the childhood histories of many addicts, you will see instances where that has not been fulfilled, and therefore the addict is left with a distorted view of themselves and the world, and use their addiction to cope with this negativity. Thus, you can often determine the severity of the addiction based on the severity of trauma that has been experienced. So here you're saying there's a direct link with the degree of trauma and the degree of addiction. So does that imply that if someone's experienced a little bit of trauma, they maybe dabble in addictions, and the deeper the trauma goes, typically the higher the degree of severity of addiction?
Well, I think what it shows is I know for myself, the biggest confusion is like, how does somebody get to the point where they're choosing heroin versus just having a few drinks after work? Like, how do you get to that point? And what Dr. Mate was noticing when he was dealing with addicts was the people that are on the street that are engaged in like some of the heaviest drug use, like, because he works in East Hastings in Vancouver, and what he was noticing is their trauma history, like those people, their trauma is enough to turn your stomach, right? The level of pain and suffering that they've experienced would make sense that they need to engage in more intense behaviors to be able to help manage the trauma. So not that there's necessarily like less trauma or more trauma, but just it helps to put into perspective. If you ever want to know why is somebody engaging in a behavior that seems so destructive, sometimes the compassion comes from knowing like there must be a lot of pain in there that they are trying to cope with, so they need to keep on upping the ante to try and make it work.
Right, that makes a lot of sense. And then is the solution there to deal with the trauma? If you deal with the trauma and the underlying issues, do you see more success in terms of recovery?
Yeah, when people understand what is kind of driving the behavior, what they're trying to avoid, and recognize that I know trauma seems scary to have to go back and dabble in it and experience it and witness it, but the truth is that it's always scarier when it's a monster in the closet. Once you realize that it's just hangers and clothes, it becomes a little bit easier to manage. So